Thank you all for attending today. We're very excited about sharing this review of recommendations from Accreditation Guru experts on our master forms. So looking forward to sharing that with you today. So we're right at 12:30. We have a brief presentation. We want to bring you up to date. We are going to be updating the master treatment forms this Friday evening. And we wanted, besides circulating all that we circulated over the past couple of weeks, we want to review it with you, make sure you're comfortable, confident, you can share it with your staff. Again, these are recommended updates by Accreditation Guru, who most of you know that we've done several webinars with them. We value their opinion on the Joint Commission and CARF standards, and they have recommended a series of updates to forms which we have put into play. So today we have on our presentation panel Maria Gray. And Maria, most of you know, is our product manager, and she's our lead on-site implementation specialist. Maria's got a great background from addiction treatment work over this past pretty much decade or more now. So we really value her opinion and her listening skills as she brings back excellent feedback from all those that touch. And you all have been fabulous. You all give us feedback. You give us your recommendations and suggestions, which has helped make the technology better and better and better. So I can't thank you enough as CEO and founder of the company. We're glad you're here and we want you to stay. So please communicate with us and share any feedback that you can. We also have Joshua Rhoades. Josh has been with us for over a decade as well. He's the manager of the forms team. So those beautiful forms and all the drop downs and all the sections and all the selections, Josh and his team have been responsible for. Josh has worked very closely with the Accreditation Guru experts on these TJC and CARF recommendations. So we're real pleased to have Maria and Josh share with you today. Review what they've recommended, review how the changes that are currently in the form, and make you comfortable with what you're going to see on Friday. If you've used these master forms in your account, you will be assigned these forms. They will switch them out. So thank you for joining, and we want to make sure that you're very comfortable. We also appreciate when you do have audits by CARF or Joint Commission auditors, when they come through, giving us feedback for us to be able to constantly update the forms throughout the year. But there were some pretty major changes that we felt were relevant to get our masters up to date. So with that, I'm going to pass it off to Maria and Josh to begin the presentation. Thank you.
Thank you, Coletta. I do want to mention before we jump into this that the forms impacted are, of course, as Coletta mentioned, it's only the AZZLY Masters, not any customs, but not only the Master Treatment Plan, but also if you use the Comprehensive Master Treatment Plan or any of the diagnosis-specific treatment plans, such as the substance use, relapse prevention, anxiety, etc. All of those treatment plans will be will have these changes applied to them as well. So Josh, are you going to share your screen, please? And we will go ahead and get started. Great. So I'm going to go ahead and Josh is going to share his screen, and we're just going to scroll down the screen, and I'm going to just point out the changes that we have made. And again, these are according to Joint Commission and or CARF. So you'll notice at the top of the Master Treatment Plan, we have added the fields for client identified strengths, their preferences and abilities. We also have added a section for outcome measurement tools. Have any outcome measurement tools been performed? So with that, we're talking about, the GAD-7, the PHQ-9, etc. So you have the option to click yes or no. And if you select yes, then of course you can enter the information as much as you need to regarding each outcome measurement. You can enter all of your information in one field if you would like, so GAD7, comma, PHQ9, etc. Or if you want to use the add another box, you may do so and have your details for each of those listed out. As we scroll down a little bit more, you will see the field needs to be addressed. So according to Joint Commission and CARF, they prefer to use the term needs now rather than problem. So we have reworded it to needs to be addressed or need to be addressed. We also have a section for adolescents, or we've added a tooltip, I should say. When I say tooltip, that indicates anytime you see that small dark circle next to a field with a small question mark in it, when you hover over that, it will display additional information. So for adolescents, we have added the additional information for, to consider academic and educational needs, etc. Okay, excellent. Thank you, Josh. And we've also added in the goals a field we've changed it to read long-term goals in clients' own words. So we did have before the ability anyway to add that statement within a text field, but just to make sure that it's covered, we renamed the field so that we ensure that it is mentioned as the goal in the client's own words. Okay. And then as we scroll down a little bit further, you will notice that there's now a field for progress / lack of progress towards an objective. It is recommended to document as you update the treatment plan, whether or not they're making progress forwards or backwards towards any objectives. Okay, and then as we move down, you will see a field that asks if any needs, or if there are any needs that need to be deferred, yes or no. If yes, you will list the reason for the deferral, and also answer, will any care, treatment, or services be referred to external resources? And if so, specify within the text box at the end. Okay, and then also the statement at the bottom of the treatment plan has been updated as well, according to Joint Commission. So these are the changes that have been made and applied. These, as Coletta mentioned, will go in on Friday night, this coming Friday on the 16th. So, or not the 16th, let's see, the 13th, I apologize. Yes, I was having a moment. So if you have any questions regarding any of these, please throw them in the chat within the Zoom, and we would be happy to answer any questions you may have. And we hope that you find these helpful fields for your documentation and your patient care.
Great. Maria, thank you so much. It's a reminder, Friday, September 13th, we're going to release this in the evening. The team will be testing to make sure that everything is functioning as expected. We do have some time for questions. I did get a couple in advance. Is the IMR functionality, the import most recent, which is one of the most enjoyed features within the charting experience, will it be affected by these updates? Maria or Josh?
I can answer that. So we have not taken away any fields. We have only added fields based on those recommendations. So when you IMR, all of the data that you've previously entered will pull forward because those questions remain unchanged. The questions that we added obviously won't have any data in them when you IMR because they are brand new. They have never stored any data previously. But yes, IMR will continue to function and will remain unaffected.
Josh, can you scroll back up and review those areas, those most important areas where, again, as you mentioned, what it's going to show when you select import most recent from these master forms, it's going to bring it forward, but you will have now some blanks. Once you fill in those blanks, make any other modifications you want and save, finalize and save it. Then when you use IMR again, it will bring forward this new data from these new fields. So Josh, great job on that, because it's always a concern if I have to re-enter all the information again and the IMR will not function. So great job in this case, being able to do that. Another question that came in is, is there anything I need to do in advance? Do I have to send a notice in? Is there anything I need to do before Friday?
There's not anything that needs to that you need to do before Friday. This will automatically take place on Friday. I would recommend, I guess I take back my answer a little bit. I would go ahead and ensure that you communicate with all of your clinicians these changes so that it doesn't catch them by surprise. That would be the only item that I would recommend taking care of in advance.
Okay. And this meeting is recorded, so we will have a recording if any of those that have attended. And Maria, maybe what we'll do, because we had a lot that did sign up that weren't able to join today, maybe we can get that recording as a macro and Zen that would be available for additional sharing. As you see, it should not be very disruptive, but you will find if you have any CARF or Joint Commission audits coming up, that it should meet their latest and greatest requirements. Andrew, if you could put up that brief survey, we have just a couple questions we'd like you to fill out. One of it is on the whether you are CARF accredited or whether you're Joint Commission accredited or both. We would value your feedback on that. Josh, you had a question, you had a comment that you put in chat. Go ahead.
Yeah, so for any clients who previously used the AZZLY Masters, but then had a submitted a custom request for custom master treatment plan, substance use treatment plan, relapse prevention, etc. We've made these updates across the board on the masters, both to the client and patient verbiage of all of those sets. If you did previously utilize the master but are on a custom, you won't see those changes made to your custom forms. If you do want those changes made to your custom forms, those fields to be added, we just ask that you submit via the normal process through your unique form modification submission tool in Smartsheets. And then we will place it in the development queue and get those updates to you.
If you do want to have smart sheets, if you're not familiar with what we're referencing, just go ahead and email clientservices@azzly.com and we can provide further instruction. And I do see that we're getting some responses to the poll. It depends on the size of your screen, I believe, but I see that many have answered number 1, but if you were to scroll just a little bit, there is also a number 2. And if you've already closed your poll, if you don't mind maybe throwing it in the chat, we would like to know if you have found this webinar to be helpful and informational. The question was asking to rate 1 through 5, with 5 being the highest and 1 the lowest, but any feedback you can give, we'd like to ask this question so as we continue to roll out new updates, we can discern whether or not you all find this to be helpful with those. On that note, as Coletta mentioned, we will be making updates to other forms within the system, other master forms going forward, such as the biopsychosocial, the individual session note, etc. And we will reach back out in advance prior to making those changes to inform you via email and likely a webinar on those as well.
Great, thank you. I do not see any other questions. Thank you everyone for joining. We will have additional webinars scheduled in our educational series that Maria and the team will be presenting to you. If you have any recommendations or suggestions as far as educational webinars on features and functions within AZZLY that you'd like to learn more about or dig deeper, please send them into clientservices@azzly.com. Again, thank you for joining. We appreciate your time. We're glad you're here. And Josh, Maria, thank you so much. Have a great rest of your day.
Thank you.
Thank you.
All.